Hello everyone, welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. So doctor, now we are on retinal diseases, do's and don'ts. Doctor, my first question for you is, what are the common symptoms of retinal diseases and when should I seek medical attention?
Basically, if patient is a myopic, they can sometimes they might be undergoing a retinal detachment. Other diabetic patients, they are more prone for the retinal diseases like a diabetic proliferative retinopathy or some hypertensive patients where they need an hypertensive retinopathy. These are 2-3 main diseases where the retina get involved. And if the retinal disease get involved, definitely the patient will have a sudden loss of damage or sudden visual loss, or sometimes it's a slow visual loss. So some means patient has to be categorized whether the patient comes with a sudden visual loss or a slow visual loss. So there are so many diseases are there in the retina that you have to check whether you are having a retinal diseases problem.
What kind of lifestyle changes or habits should I adopt to protect my retinal health and prevent diseases?
Specifically, if you see, the retinal diseases are more prone in a diabetic patients. In a diabetic patient whose blood sugar is not under control or who is having a fluctuating sugar. In these patients, diabetic retinopathy is a common disease where you can see. In that patient, you should maintain your sugar. That is the main culprit. Sugar is the main culprit of your retinal health. So you have to maintain your sugar nicely, and if you maintaining your sugar and routinely if you are follow up with your retina, then I don't feel the retinal damage will happen more. Sometimes what happens in age-related macular degenerations, there are certain diseases where the vitamin supplementation is a must in these kind of cases, where the age is more than 70, 75 and the retina degeneration starts. That's called as age-related macular degeneration. In that cases also you have to take some supplements because of the vitamin deficiency. These kind of diseases happen.
Are there any specific activities or environmental factors that I should avoid to reduce the risk of retinal diseases?
Environmental diseases as such, there are no any environmental problems where you can have a problem with or you will land up into the retinal diseases. But specifically, as I mentioned, that diabetes, hypertension, high myopia, these are the main patients where you will see, and age-related changes of the retina. These are the 4 main diseases where we should always evaluate the retina every quarterly or at least twice in a year. So these are the patients who are diabetic, who are the hypertensive, who are having the minus power very high, more than -6, -7, and the age-related patient. These patients should undergo the investigations first.
So doctor, your expertise and insights on retinal diseases, do's and don'ts are invaluable to this initiative. And we believe your participation will greatly benefit the patients.